Oh, welcome back on a Monday. We know so many New Year's resolutions involve getting more exercise. Can you relate?
Yes, literally, we've been talking about it all morning. But before you start changing any habits, you need to get a checkup from a cardiologist. Joining us to explain why, Cardiovascular Health Clinic's Dr. Marcus Smith. Doctor, thank you for joining us. First question, why should someone have a heart check before starting a new exercise program?
Yeah. So when you start an exercise program and you start to exercise, obviously you're increasing the demands that you place on your heart. Those demands usually come in the form of increased blood pressure and heart rate. In individuals who may not know that they have an underlying heart issue, that this may precipitate a cardiac event during the exercise.
Doctor, if you like to run or exercise outside, can the weather, like extreme temperatures, can it affect your heart? And what are the signs during a heart attack?
Yeah, actually, temperatures do affect your heart. And in fact, we think of hot weather more frequently than we do cold weather. But cold weather can precipitate some narrowing of blood vessels, some constriction of blood vessels, which can raise your blood pressure, can raise your heart rate. It can also slow down the flow of blood within the arteries. So definitely these weather changes can affect the way your heart functions.
What do you want people to know who are listening this morning about these New Year's resolutions and getting back into the gym?
Well, I think we know that when you start an exercise program, I think you start slow. I think you beforehand have discussions with your doctor about, are you healthy enough to start these activities? Usually that's people above 40 that have risk factors, whether that's blood pressure, diabetes, kidney issues. So you want to make sure that you're healthy enough to start the exercise. And I always tell people, you just start slow, make manageable goals, and realize that this is a journey, not just a single step, but it does start with just a single step. So I encourage all my patients to make this an emphasis, especially as we get into 2023.
Dr. Smith, great information this morning. Is there a place where folks can go to learn more?
Well, I mean, I think you start locally with your own doctor, having conversations with your doctor, whether it's a primary care doctor or whether you have a cardiologist, having those discussions with your primary care provider first. And then there are resources available to us. The American Heart Association, for one, has a wealth of knowledge about starting exercise. We usually follow those guidelines saying that we want 30 minutes of moderate activity 5 days a week, and we can define further what moderate activity is, which is usually walking outside. If you're walking a mile, try to do it quicker than 20 minutes. I think these are kind of rough parameters, but the American Heart Association really does lay out some really good groundwork for what activity is, what it looks like for your age group, and what our goals are for achieving that.
Yeah, I really want to have realistic goals. Dr. Marcus Smith, thank you for talking to us. We appreciate you.
Thanks, guys. Have a Happy New Year.
Happy New Year
to you as well.